Welcome to the latest episode of the Podiatry Business Podcast with myself, Lorcan O Donaile, podiatrist and podiatry business mentor. So today's podcast title is Should You Sell Products? A Podiatry Clinic Owner's Guide to Retail Revenue. So this podcast comes from a question I was asked in one of my group coaching calls. Should I stock products? Should I start selling products? And I think it's a question that a lot of clinic owners face. And some do and some don't. And I want to go through the pros and cons and why it matters for a clinic that's trying to basically increase their monthly revenue, increase their profits. So what you want to consider is there's a difference between product sales that will enhance your products and those that will drain your resources. And you have to make a decision on whether it's necessarily the best thing for you and for your business to do so. Now, there is a case for selling products. Let's go through that first. So the first is the obvious one, additional revenue stream. And it's a relatively passive income potential that you can get from your existing patient base. So you can sell to the patients that are already coming into your clinic, obviously, new products, new creams, footwear, whatever it happens to be if you're a podiatry clinic. Because it's like McDonald's. Do you want fries with that? You can consider the idea that you might have enhanced patient outcomes, that products that you can provide that will support treatment plans. Now, I'm mindful I don't consider in my clinic orthotics products, but I'm going to use it here because I know some people do. So maybe orthotics, maybe specialized creams, maybe even specialized types of footwear. You're going to probably find maybe an increased patient compliance because there's a convenience of having a one-stop shop to get that product. That rather than having to go and search for the product online or having to go downtown to find it, they can get it right there and then from you and from your clinic. You could say that it positions you with a higher perceived value because you're a more comprehensive provider of solutions. And typically, the margins on retail products are quite high. They can be anywhere from 40 to 60%, depending on the product that it is that you're selling. Lastly, it can give you a recurring revenue model. So maybe there's a particular cream that people need to get on an ongoing basis, and they can get that from you every time they come in. Now, that's the case for selling products, and it's a pretty strong case. But there is a case against selling products that you have to consider. Don't just jump into getting it. So you have to have inventory, and inventory management can cause a lot of headaches. Your cash gets tied up maybe in stock. I have seen clinics who have a huge sum of money tied up in footwear, for example. You've got to store them somewhere. Maybe you've started to take up a room that you could have used for clinical treatment to store that stock. So you have storage space issues. It can be a serious distraction from your core services. So maybe what's happening is that as a clinic owner, you'll find that you're spending a lot of time on the retail versus the high value clinical work that you could be doing in the same period of time, which is kind of brings you into like a low return on investment on the effort. So the hours that you have to spend managing products and everything that comes with products versus time working on other aspects of your business. So for example, if you have to spend an hour or a week working on inventory and ordering and so on for products versus an hour working on maybe a marketing system that you just plug in once and will run forever, you have to look at, is it a low return on investment for the effort that you're putting into managing those products? There's staff training requirements. So your team is going to need to know all about products. You're going to need sales skills. You're going to have to explain all of this to them. And there's a risk with that your teams then start to think that it's all about selling stuff to patients as opposed to giving patients the outcomes that they need and what's best for them. You need to run a fine line on that. And there's a very serious risk of unsold stock. That you might have products that actually you get in and nobody wants. They go out of fashion, they don't sell, or maybe they'll even expire. And you're the one left holding all of that unsold stock. So you need to consider the pros and cons of both, and when you're coming to the decision making of whether you as a clinic owner, it makes sense for you to sell products. and it doesn't always make sense for you as a clinic owner. So the first thing is you should really only sell products that are going to directly support your treatment protocols. You should try and sell products that have a high turnover and a low maintenance, that there's not a lot of work in them. Footwear, for example, can take a lot of work. You might have to spend half an hour fitting, getting sizing, so on, and then that person might not even buy the footwear at the end of that. That is a lot of time put into something, a lot of maintenance, and you're probably not going to sell as many footwear as you might do creams, etc., etc. The margin that you sell must justify the overhead or the operational overhead that you have to put in. So if you're putting so much time and effort into something and all you're making from it is maybe 2 or 3 quid an hour because you're not selling too many of them, is it worth it? Versus if you put that time and effort into selling more high ticket items, services, treatments, and so on. Staff can find that, like I said earlier, that it's hard selling. So you need to make sure that you can find that the staff are willing to recommend it without having to hard sell. That's got to be important. So whatever the product is, that they buy into it and they see a real need for it. So you got to sell products that directly support your treatment protocols. You got to have products ideally that have a high turnover and a low maintenance, and that have a margin that justify it, and that staff agree that this is a good idea. What you ideally want to do is you want to kind of focus on the 80-20 principle, the Pareto principle. So which is, what are the 20% of products that are probably going to generate 80% of your retail revenue without you taking over your time and your effort. So some categories. So let's assume now that you're thinking, well, this actually might be worth my while. What categories could I use that would work in your podiatry clinics? Well, the obvious one is going to be orthotics and insoles. There's a higher margin and they are treatment related. Now, in all cases, I am only recommending something that is appropriate and necessary for that patient. Specialized footwear, diabetic footwear. This is a highly specialized product, and there's a high margin on these, and your expertise can be quite useful in these cases. Foot care creams and treatments, because there's not a lot of work for you in having them, and they're not going to take up a huge amount of space, and they sell quite quickly. You can have a quite high turnover on these. Maybe you're going to sell some hosiery or socks or compression socks. Maybe you're going to sell some nail care products that you're recommending the patient gets. In some cases, I've seen people sell home care treatment devices, but you have to make sure that you're obviously providing proper training for that. So there's some simple products you can consider. Now, there are products you should try to avoid, and they are things like generic items that the patient can probably buy just cheaper on Amazon, or products that require extensive explanation or training. That's going to take a lot of your team's time when it comes to the sale process. Low margin, obviously. If you're selling something and it's not giving you a good margin, you are in business to make a profit, well, then maybe it's not the smartest thing to do. Products that are have a short shelf life or are trendy now, or something that's just simply not unrelated to foot health, unless you're going down the route of actually opening a proper shop, then I would urge you to stay away from anything that's not related to foot health. So there are some systems that you have to have if you decide, yes, I've looked at the pros, I've looked at the cons, I know what I want to sell, what am I going to need, what systems do I need now when it comes to it? Well, you're going to need an inventory management system, so you need to be able to track your stock levels, you need to know when you're going to reorder, you need to check expiry dates, you're going to need a point of sale system, so you need a seamless checkout process, and you need to make sure that you have all the economics of that, the accountancy of that well done. You need to have a staff training protocol so that your team have product knowledge and they have the recommended scripts to follow when they're recommending something, both your clinical team and your admin team. You'll need to have a marketing strategy so that you're able to promote these products without coming across as salesy, because that's not what you want to do. And you need to have a relationships system for your suppliers so that you end up with good vendors, that you have good terms, and that you have a good relationship with them. The last one that probably goes without saying is having good quality financial tracking. And you need to make sure that when you're tracking your financials, that you're tracking your product financials as a separate thing from your services, so that you're able to measure the return on investment and is it worth your while? Because it is okay to do products for a while and realize, actually, this is not worth my while and I'm going to stop. Now, there is an alternative, and the alternative is to consider maybe like what we call an affiliate or a partnership model. So what you'd essentially do is you might partner directly with suppliers who will ship directly to the patient, and all you're having to do is recommend. You're not having to hold the inventory, and you're earning a commission from it. It's a lower risk, there's a lower reward. You're maybe not going to get as higher a margin, but there's practically no operational headache. And in some cases, what they'll do is they'll even embed their shop into your website, which makes life even easier for you. This can work quite well for things like maybe even diabetic footwear, certainly works for orthotics and so on, and it is something to consider. So let's talk about some real numbers, what you should expect. So with the average clinic, unfortunately, what I see is that the revenue is quite low. It's not as big a thing as they expect, the clinic owners often expect, and it is not really going to be a game changer unless you open a shop on its own. The time that you're going to have to put into it is probably going to be anywhere from 5 to 10 hours a month for management of your inventory, depending on the size. And your margins are going to be typically about 40 to 60%, depending on the product that it is that you're selling. It can take a while for you to break even because you've got to get the stock in, and typically what we see is that clinics can take 6 months to recoup that initial investment. So you got to put the cash out, you got to be willing to put 5 to 10 hours aside every month, and you got to understand that it could take you 6 months to recoup that investment if you go all in on this. So if you're thinking about this, you need to have a decision framework. You have to ask yourself, does this product improve my patient outcome? Does this product and does this decision serve me well as the clinic owner? You have to calculate the time you're going to be spent managing the products versus doing other high value work, maybe seeing another patient, or actually even higher value work, working on your business. You need to consider your clinic's current revenue and growth stage. Is it kind of maxed out and the products is the next normal thing that you should be doing? You need to evaluate, is your teams going to be able to manage this retail operation, and have they got the capacity to do so? You might then decide what you're going to do is you're going to test. You're going to start small. Maybe you'll do 3 or 5 high demand products before expanding, something that's not going to have for you to have to put out a lot of cash into it, and that you can get rid of quite quickly. You can have a high enough turnover. Dip your toe in the water before you go all in buying hundreds of pairs of shoes, for example. Now, what would I recommend? For clinics that are doing less than, say, £40,000, $50,000 a month, I would tell you to focus primarily on your services first and products second. You can absolutely do products as long as it's not taking a lot of time, as long as it's not taking a lot of cash out of your business, and it's something that's relatively passive. The key should be that the product should enhance your core business, which is services, which is delivering a service of podiatry, and not distract you or your team from it. So your best approach is probably to start with treatment related consumables that patients already need and that you're having to recommend that they go and get. So your next steps really should be to consider audit what products you think you currently recommend patients buy elsewhere. Calculate the potential revenue from those top 3 to 5 products, and see is it worth your while. Then have a look and see what suppliers you can get them from and what margins you think you can make. Test with a small inventory over, say, a 90-day period. Give yourself a 90-day period to test, and if at the end of 90 days it's not worth your while, pull the plug. Sell off the stock if you have to at cost price and move on. But you're not going to know unless you test it. You've got to track your time investment versus the revenue generated. What we tend to do is we tend to find is a lot of clinic owners will put a lot of time and effort into something, and they'll find that actually the return was not worth it versus what if they put that time and effort into something of higher value for their clinic. And if it works, scale it. If If it doesn't work, eliminate it. As simple as that. So, to finish, what I would say, my thoughts would be the products aren't inherently good or aren't inherently bad. It's really about strategic fit for you and for your clinic. And your goal really is, as a clinic owner, is that you want to work less but earn more. Okay? Or certainly not work any harder. That's what I would see happens with most clinic owners. Most clinic owners I speak to, they're not looking to do nothing. They're looking to maybe not work as hard. They feel stretched. And if you adding retail products makes you feel more stretched, then don't do it. Because at the end of the day, it's about building a business that gives you the life that you want. And you want to make sure that you're getting high value for the time and effort that you're putting into this. Remember that the expertise that you have, either running a business or treating patients, is going to be worth more than the margins you'll make from products. So products should sit on top of that, almost like icing on a cake. And if you're not at the point where your business is big enough, I would not focus on this too heavily. And finally, I'll tell you about my own clinic. So obviously we provide, as a podiatry clinic, we provide orthotics in our clinic, but we do it as part of our treatment plan. So we don't really consider them as products as such. The only other product that we sell in our clinic is cream. We sell CCS cream because I recommend it all of the time and it's easy to have it there. I don't really do it to make a margin. We do make a profit of it, but I do not get into products. I have tried it and I found that it was taking too much time, too much effort, and it wasn't worth it. I've also spoken to other clinic owners who have gone right down that road, including opening shoe shops next door, and regretted doing so, and found that it was taking so much time and effort and the margins were so much smaller than they were when they were treating patients. So the decision that I made for my clinic was I was not going down the road of products. But like I said earlier, that doesn't mean that it's not the right fit for you. So go through the steps I've talked about here, think about it, and if you feel that it's the right thing for you and for your business, dip your toe in it, try it for 90 days with a small number of products and see how you get on. So that's it for today's podcast, all about products. I hope you found it helpful. If you decide you want to have any more help with us here at More Practice Profits on your business, we do business coaching, like I said, group coaching. Just feel free to reach out to us, whatever way works for you, and we'd be delighted to have a quick chat on the phone about how we can help you. Until next time, this is Lorcan O Donaile, Podiatry Business Mentor, signing out.